Harm reduction is a practice approach designed for people who have made the decision to use alcohol or other drugs. It's also one pillar of Australia's national drug strategy. I'm going to take you through some key principles for providing good quality harm reduction advice, then share example strategies. Right message. We need to deliver the right information that's factually correct. So you need to know a bit about the drugs, how people use them, their effects and potential harms. Right young person. Harm reduction information should be delivered to young people we know are using or planning on using alcohol or other drugs. We should choose the right time to have a harm reduction conversation. We want to make sure people can take on board the information that we're giving them, so not when they're in a crisis or really intoxicated. Aspirational versus realistic. We might aspire to assist a young person to implement the safest possible strategy, but if that's not realistic, what's the next safest option? Consider insight and ability. As well as providing harm reduction advice, we need to assist young people to develop insight into their substance use, as well as improve their ability to implement strategies. This might involve things that don't directly address substance use. It might be interventions that help with emotional regulation, or it could be assisting a young person access safe accommodation. So where to start when discussing specific harm reduction strategies? One way to think about this is to consider the intersection between the drug, the person and the environment. The drug refers to harms related to the substance. This includes the amount and frequency, the route of administration, and the characteristics of the substance. Some ways young people can reduce harm in this area include: learn how substances work, including dosage and signs of overdose; changing to a safer route of administration; to avoid sharing utensils like injecting equipment, bongs, and snorting straws; and to switch to a safer form of the drug, like vaping nicotine instead of smoking tobacco. The person refers to the characteristics of the individual. This could include age, body weight, and physical and/or mental health, but also includes a young person's experience using a substance. Harm reduction strategies focusing on individual factors include: eat before using and stay hydrated; help them understand substance use interactions with any prescribed medication; that young people and people with smaller body weights will usually require less of a substance than their larger friends; to avoid using when experiencing negative emotions; and to take breaks when using substances. The environment refers to settings where alcohol and other drug use takes place. It includes where drugs are required and the physical and social environments where substance use occurs. Some harm reduction strategies focused on the environment include: using with trusted people who can call 000 if help is needed; use in a safe place, like a friend's house; plan for getting home afterwards; use known, trusted dealers; and if using in hot places, stay well hydrated and take regular breaks. So thinking about the drug, the person and the environment is a great way to consider all the ways you can help young people reduce drug-related harm.